Welcome back to ZPTV. It's Amanda, and we are continuing with our segment of Ask a Specialist. Because April is Foot Health Awareness Month, I have been honored to have a guest in my studio today. This is Dr. Gus Constantouris of Constantouris Foot Care. So tell me a little bit about your practice.
We are podiatrists. The practice consists of myself and my wife, and we offer personalized service to all our patients.
Oh, nice.
We've been serving the community since 1995.
Wow. So why would a person need to go to a foot doctor?
So patients will come to foot doctors for numerous different types of conditions of both the foot and the ankle. Usually they'll come in for different types of skin conditions. Skin conditions would be things such as painful ingrown toenails or deformed fungus nails. Patients may come in for situations associated with bunions or hammer toes, which would cause them pain while walking or while in shoes. A lot of times they'll come in for heel and arch pain, which is very common today with people standing long hours or through different types of sports or athletic activities. In addition to that, we'll see patients who come in for different types of conditions associated with diabetes or poor circulation. We'll see them and they require treatment in order for preventative care or for care when acute conditions do come up. And of course, we'll see patients such as children or younger patients who present with different types of skin conditions. But in addition to that, patients who have arch pain and heel pain who may require different types of orthotic treatments as well.
So you mentioned that you do see pediatric. What is the age range of the patients that you see in your location?
So the age range of the patients will extend anywhere when a mom or dad will be concerned about a child who's 1 or 2 years old, and they'll come in for an ingrown nail, they'll come in for deformities in their feet. We'll see them progressing through the adolescent stage, where at that point those children may be doing a lot of different sports activities and athletics and they have pain. And then of course we'll see our middle-aged patients who are working hard, going to the city many times and have foot conditions. And of course the geriatric population who could have associated different types of arthritides, who may have diabetes or may have poor circulation.
So what kind of treatments would be offered then?
So the different types of treatments we have are always conservative in nature first. Conservative in nature being that if they come in with painful ingrown nails, we'll treat the nail, we'll remove a portion of the nail, we'll debride the nails. If they have different types of skin conditions, we'll prescribe different types of creams or different types of topicals in order for treatment, or if required, we'll do different types of orals. When they come in for different types of structural foot deformities, we'll either debride the areas that are a problem with different types of corns and calluses, or we'll prescribe different types of dispersion pads for protection. And of course, even to the evaluation of the patient's shoes, so they're wearing the right shoes or sneakers, so this way they don't have recurrent problems. In certain cases, when conservative therapy is not available, or if it fails, and there's certain people who have chronic problems, surgery is available for these patients, and we'll proceed to do whatever surgical procedure is required, anything from hammer toe surgery or bunion surgery or other types of foot surgery that's required in order to alleviate the patient pain.
What types of radiological exams would a podiatrist be ordering?
So when a patient comes to the office, x-rays will be taken in the offices, possibly as either baseline x-rays or x-rays to evaluate what the condition is. In addition to that, an ultrasound would be done if there's a soft tissue condition. At times I will do that in the office if the patient requires it, or at times we'll refer the patient to Zwanger-Pesiri radiology. When we refer them there, we may also refer them there for an x-ray if required, or for an ultrasound. In addition to that, though, what's important to recognize is many times if a patient has an injury to the foot or has a potential fracture, the x-ray very often will not show the fracture that's present. Mm-hmm. And therefore, having a high index of suspicion of what goes on, we often will send that patient for an MRI. When the MRI is done, we will get a better assessment and evaluation of the condition. In addition, we may have to send the patient for a CAT scan, or we may have to send the patient for a bone scan. And there are times when we send the patient for ultrasounds, because in addition to that, we have the read that's going to be done by the Zwanger-Pesiri radiologist, who will better help us with assessing the condition.
So there's a lot of comprehensive testing that are being done to really get a full understanding of the patient's ailment.
Yes, I believe it's always important for us to make an appropriate diagnosis, and making an appropriate diagnosis means going through all the diagnostics that are available, which includes everything from an X-ray all the way to an MRI. And we make every effort not to delay that, because often if the treatment is delayed, a patient will go undiagnosed for sometimes periods of weeks and months because the doctor didn't go through the proper protocol of evaluation.
Which could really just exacerbate the problem even further.
Yes.
Well, thank you for trusting in Zwanger-Pesiri Radiology.
I refer all my patients to Zwanger-Pesiri Radiology. One reason is because of the machines and the technology that's available. All the machines are updated, the technology is excellent, and the quality of the images are very, very good.
Good to hear.
In addition to that, I refer there because the radiologists are extremely competent, they're extremely compassionate and caring about the patient, and they will often call me and we go over the results together. So this way we know that we haven't missed anything with regard to the diagnosis. And the other reason I sent to Zwanger-Pesiri Radiology is because they will always get the patient in immediately, meaning that there are patients who will come to my office, they have an injury, we need an MRI, and we will get the MRI usually within several hours or by the end of that afternoon. And I find that to be a very important thing for patients and care. Just recently I had the patient in my office, it was just yesterday. She had an ongoing pain for 3 months. She needed an MRI. She was expecting to go in 1 to 2 weeks, and with 2 phone calls, the patient was in that afternoon, and she was very grateful and very happy about it, and we had the report back by that evening. So I was able to call the patient before the end of the day and tell her what was wrong or be more specific about her condition.
Oh, that's really wonderful news. I'm so happy to hear that we were able to accommodate. And thank you for trusting in Zwanger-Pesiri Radiology for all of your needs.
Thank you.
So tell our viewers, how are they going to be able to find you?
So we have 2 locations. One is in Comac, and the other location is in East Setauket. The only doctors you'll see in the office are myself, or if you prefer a female, it's my wife. Both of us are there to serve the patients. The office is a very small office in the sense that we really care about our patients. We're very compassionate, caring within the office, and when we see the patients, we make every effort to manage their conditions. Our website is ConstantourisFootCare.com or FootCareLongIsland.com, all spelled out.
That sounds great. Thank you for sharing the morning with me today, and I'm glad that you were able to be here. So stay tuned for this funny 50s throwback. We look forward to seeing you next time. Take care.